gonna
row
be kind
seat.
of in this area to start, so yeah, you can kind of do a semicircle around. I'm gonna come around this side too.
Oh, careful. Watch where you're moving.
All right. Okay, so we are just basically thinking through this from start to finish. You would, at this point, still have your operator gloves on, okay, because you just finished the procedure. So the first thing that you would do is take your operator gloves off and throw them away, and then wash your hands, okay? So we're gonna come over here and do our, okay, there we go.
Musical pipe.
Yeah. Do our antiseptic hand wash. Okay, and dry your hands really well. And then we're going to be using our utility gloves. So that is, I believe, number one.
Number one, because it has don the appropriate PPE, and it tells you, you know, you have utility gloves, you have masks, and you have goggles. So for us now, we have the face shield, so you may or may not have the goggles with it. When you're at pit, you're gonna have those, and you may also have your scrub cap on, but you can. The next thing it says that right now, like what you're envisioning is that the patient you've just walked them out to the reception room, they're taking care of the part of paying their bill, and now you come back and this is what you see. You have a contaminated tray there, and it's getting you through the steps. When you're at pit, everything will go into a bag, and then it magically goes to the sterilization room at pit, and they take care of it. In private practice, there's no magic. You are the one, and that's why you're practicing this. It's one thing we cannot do a lot of practice at pit. You get lots in the summertime. Okay, so the second one says, bring tray to the contaminated area of the sterilization room.
Okay, so what I want to first show everybody is that if I went over here and I picked this tray
You
up,
want to maybe sit down while so you wouldn't.
I'm going to actually move over here.
Okay.
I'd pick this tray up and walk like this. What could happen? Say Rachel came around the corner and I bumped right into her. Stuff would fly everywhere because look at how trays can sometimes end, okay? So what you're gonna do, I'm gonna wiggle around here so everybody can see me from the back, is you're going to organize your tray before you walk with it, okay? So things like the handpiece, you're gonna move it over to the side. Things like your biohazard, you're gonna move that over to the side. Yeah, can everybody see our fake blood? This is marker, but in the event that it was patient care, it would be real blood. Then we're gonna move our anesthesia carpal over, or syringe over, our little throwaways over, and then really all we have is our base instrument cassette, okay? So then what you're going to do is just organize. Remember, the neater the better when you open it back up. For the next patient after it's sterile, you want it to be nice and neat. So you know we have these little brackets. We're gonna push on each side to close our brackets for safe carrying. And then remember how we did this? We fold it, those that have wrapped cassettes with me, you fold it like a book and make sure those two little nuts are parallel. And then you just close those two little nuts. Make sure you have it nice and tight so they close, and make sure they're horizontal then, okay? So then you still have some things over to the side here, but it's nice and neat that if you would crash into somebody, you have a lot less going on, okay? So what we're gonna do, this is ready then to take to the sterilization room, okay? So we're gonna go ahead, and I'm just gonna wiggle past you, and then I'm gonna get you ladies to follow me.
So the next couple steps is what's gonna happen in here. Come on in, you can come in the back door too. So the next thing on here says dispose of sharps in the sharps container. What does she have from that patient that would be sharp?
The needle.
The needle, right. And where is the sharps container in here?
Okay, so there's one more
Okay.
thing on here that came from the anesthesia. This is actually the carpule of anesthesia. It's made of glass. So if we threw this in normal trash, that could end up injuring, you know, they say wildlife in the oceans, you know. They say that it can obviously break open and it could cut somebody that handles the garbage, okay? So we want to make sure that this goes in sharps as well. And then this is my little needle. So what we're going to do for the point of this process is we're going to bring it over and we're just going to set it right in front of the biohazard, okay? I'm sorry, right in front of the sharps container. This is the sharps container. It's the red square plastic. We would normally drop it in this little flap right here, and then it goes like this, and it drops down into the sharps container, okay?
Then next on there, it says dispose of biohazardous waste in appropriate receptacle.
Okay,
What is,
so
we haven't done this, but what's your guess? Blood.
anything that's soaked in blood or saliva, I think we actually did talk about that when we did the demo through here. But when you come over here, the biohazard is typically covered with this cassettes to be sterile, but I uncovered it. But what are you looking for in the little garbage receptacle that indicates biohazard?
The biohazard sticker.
Good, the biohazard sticker that's down in the little round hole. So we're gonna actually just set this right in front of here, indicating we know that goes normally into that garbage receptacle, okay?
Now, the next one says dispose of regular waste in appropriate receptacle.
So what would be considered regular waste on this tray?
The paper and the tongue and the.
Okay, good. And then any other gauze that may be on your tray that isn't, you know, covered in saliva or blood. Okay, so right now we just have the cotton chip applicator, the tongue blade, and then the piece of paper. Okay, so you can do the same thing. Over here is another little receptacle that is used for, I'm just gonna move these down since they, that's okay, I'm just gonna move those down. And we're just gonna set that right in front of the normal garbage receptacle,
How do
okay?
you know it's the normal and it's not biohazard also?
There's no biohazard.
There's no sign. How do you know that Mrs. Coonrod put the contaminated areas and the contaminated items in the right place? Because this is a huge room. Why didn't she put them over here, behind me?
That's where everything is sterile and clean. It's a
Yeah,
clean area.
like the signs, clean area, this means clean. Over here, actually, and there it says clean, but those are sterile. And what's the sign behind Mrs. Coonrod say?
Contaminated.
So that's why we start there and it like makes a slide through. Okay, place cassette and the ultrasonic cleaner.
Okay, so to take care of everything on this tray, we would normally take this cassette and stick it in the Biosonic. Because we're pretending today and we don't want to get this wet every time, I'm going to use a pretend cassette, which is right over here. We are going to have 2 wet and 2 dry. This is going to be one of our wet ones. It's empty, but you want to make sure these little nuts are turned just like we were doing before, because this could be open. You want to make sure that it's closed when you put it down into the Biosonic. And then, does everybody remember the Biosonic? You have to make sure that the water levels are appropriate. So when you put it down in, you put it down in with the little nuts facing up, and you drop it down. There's a metal rack in here that has little slots, so you just wiggle it down in until it sets down in. And I would let everybody peep in there, but you'll just have to take my word for it. It is covered by water right now. If by the end of the day we end up with less water, you may have to get down under here with the little jug of water and fill it up some, okay? So what we do from there is we want to start the Biosonic so it starts its cavitation and it gets the debris off of the instruments. So what we're going to do is we have to take off one glove to touch the Biosonic, okay? We can't just close the lid with our gloves on because this is a clean area. It's in the contaminated area, but this is not contaminated by germs and bacteria, okay? So just think of it like that. Inside there, the water is, so you don't want to touch the water or the instrument cassette. But we can close the lid with our hand, just like so. And then we're going to start it. Normally, we would start it for 15 minutes to run. For today's purposes and practice, we're just going to make sure you can hear when it clicks on and the noise that it makes. So I'll go ahead and click it on. There's a little knob over there, and then you can hear it start up. Does anybody have any questions about the Biosonic? Okay, so this is what it sounds like when it stops. Okay,
Okay, so the next thing on there would say to clean and lubricate your handpiece correctly.
this we're going to just have you vocalize for us, verbalize. But this is what the handpiece looks like. So do you think we can just clean and lubricate with the burr in it?
No.
Or do you think we should take the burr out and put it where it belongs? Okay. So that's going to be another part of your next process with, this is a friction grip because it's a high speed, okay? So all we're going to have to do, it's a push button. You're going to push on the back and you're going to grab onto the burr. As you push, you're going to pull straight out, okay? And then you can do the same thing in reverse. We're going to have you show us just how to load the high speed as well. So you push the friction grip button on the back, you load the burr in the chamber, and then you let go and you have to pull on the burr to make sure that it's tight, okay?
Why do you have to check it like that?
To make sure that it doesn't like fall in the patient's mouth.
Right. If
Perfect.
it's loose, you wanna find out before it's in their mouth.
Perfect. So yeah, so we're going to go ahead and take it out. And I do have the burr holder right here as well, so I'll set my high speed back down. And everybody can see what these little burr holders look like. Burr blocks. They have little tiny holes that you can put your burrs in for safekeeping. So we're just going to slide our burr back down in there. Okay? And then we're going to close that and put that back on our tray. So the next thing we would do with these items, it's not actually on your process, but we're going to have you just go ahead and bag them just so you understand what we would do in a normal situation. But all of our disposables and sterilization packaging are in here. So can I just open the drawer and start rustling through the drawer with my purple gloves on? No. Good. So you're going to take one glove off. You're going to open your drawer. And then we're going to work with the same pouches. So by the time we're finished, they'll be all wrinkly and ugly, but it's okay. We're just doing it for practice. But each one is going to hold one of our items, okay? So I can pick this up with my purple glove, okay? And you're gonna just drop it down in without touching your hand, okay? And you can just do it like that. For practice purposes, we're not gonna, this is a peel and stick, which is really nice. You just peel the sticker and fold it shut. For today's purposes, I'm just gonna have you fold it over, okay? Because we're gonna reuse these. So we're doing one for the syringe. We're doing one for the handpiece. And there is a little trick to hand pieces. If you work in an office, you will love when somebody bags them with the tubing where you would connect your tubing facing down. And the reason for that is when they open it from the bottom, they can go ahead and set it right on the chamber without taking it all apart and then turn it onto the tubing. So it's a whole lot easier if you bag it this way, okay? Now you may have noticed I touched the bag with this purple glove. You might all be saying, oh my gosh, she's touching it. But once it's out, it's okay because this is going to be sterilized. So we're going to end up with a nice, clean, sterilized package regardless, okay? So we can lay that down then. And then we're going to do one more. This burr block is just a little bit too big, but we do have little ones that normally fit our burr blocks, okay? This burr block is unfortunately just a little too big, so we're going to practice with a bigger one. And same thing, you're just going to hold it open and slide it down in and just fold it over, okay? So those are our packaged items.
In the office that you work in, what you saw was the large amalgam cassettes of our instruments you're identifying. Do you remember was there a burr block in that cassette already? Remember the large cassettes that had all the different arrangements of amalgam? Was there anything else extra in there besides instruments?
There was like, I think the dental dam piece.
The
and
dental
then
dam piece?
The block, there's a block in
There's a
there.
burr block in there. There was an amalgam well in there. So that's what's ideal, is if your office has large cassettes, you wouldn't be doing the separate bagging. But we want you to practice the bagging as much as the cassettes, so that's why we have it this way. Okay, so we have cleaned and lubricated the handpiece.
Yes.
And we removed, now you want to remove the cassette from the ultrasonic and rinse thoroughly and place in the drainer.
Okay, so once again, I'm going to lift the lid. So I'm going to take off my purple glove, go ahead and lift the lid. And then we're going to reach down in here with our gloved hand to grab the cassette. And you'll see it'll drip water at first. These cassettes hold a little bit of water. So you just want to kind of move it back and forth instead of sloshing water all over the other trays that are out here. You're going to use the foot pedal just like you do when you're, washing your utility gloves. And you're just going to rinse it off really well. There's a chemical in here that is used during the biosonic process that's basically what we're washing off, is the chemical before it goes into sterilization. So we just rinse it really well, and we're gonna go ahead and just put it in the strainer to dry.
So after the cassette is dry, you wanna wrap the cassette with the appropriate disposables.
Okay?
And again, it would be whatever the procedure is in your office. For us, we have certain things that's listed up there with the gauze and the tongue blade, with a cotton tip applicator that they all, and we actually also, have something that we're also checking for sterilization inside. So all of those are in the drawer.
Yeah, so that's what I was gonna say. So we magically are dry already. We have 2 dry ones. This is TV time, we always say. So you're going to go ahead and grab one of the dry ones. This is still contaminated, so we're gonna have our purple gloves on. We're gonna set it on the countertop, and you can set it right on the countertop, or you can set it back on your tray, whichever. But we're gonna use IMS wrap, and those that have helped me wrap, you know how to do this already. But the IMS wrap is down here in this drawer, and you'll see we'll be working with pretty wrinkly things just because we're reusing. But we put the IMS wrap down. Then we also can get our disposables from this drawer. Take our glove off. We're gonna do gauze. We're gonna do cotton tip applicator, tongue blade, and for practice we can use one of the integrators so you guys get on to putting all those things in, okay? So they're all in here and we'll help you. The little integrators are in this bag and then everything else is visible. So what you'll do, you put your glove back on. This is where you're gonna open your tray, your cassette. You're gonna peel back just one side because we wanna put these things underneath the bracket so they don't kind of move around or fall out. And then we push down our bracket and we go ahead and put this together until it's locked again. And then our cassette is ready to be wrapped, okay? So those of you that remember, it's like wrapping a Christmas present. You can actually take your purple gloves off at this point and set them aside. And we're gonna wrap it, like I said, like a baby. You grab it from underneath and you wrap your Christmas present. And we're being trying to be conservative with tape. So we're just going to use a small piece of tape to put one spot there, and then we're gonna fold both ends. And to those that remember that wrapped with me, what do you need to look at if it's a student's cassette, or say you're in an office and it's a certain procedural cassette?
The name and number on the end.
Perfect, good job. So we'll just say that for today's purposes, we will just label them. We could do DA, dental assisting, and your last name. You could just, you know, make something up, Merry Christmas. But I just want to make sure that you label it, okay? So you get the gist of that. Okay, so now that we have our completed wrapped cassette, once again, this is not sterile, but it's also free of the germs that were on my utility gloves, okay? So you can handle this with your bare hands, okay? Then where am I going to take this? What's the next step? Perfect. Now what if I don't have enough things to go into the autoclave? Where would I put it as a holding area? Yes. If everybody looks behind, do you mind shifting just a little to the side? There's a little bin there that says cassettes to be sterilized. If we don't have any other cassettes, we're just going to place it in that holding container, okay? But if we are going to go ahead and load the autoclave, I'll come over towards Miss Eustache and I'll show you this. Do you want me to do anything over here before?
You wanna grab your bags too?
Sure.
Because everything that's gonna go into the autoclave, you have the bags and you have the
Make sure.
cassette. And all of them, how are you gonna tell if that cassette, when you're done, actually has gone through the time in the autoclave? Okay, does that tell you it's sterile?
No.
It does not. But that we use that. So with those cassettes, we put them in so we can see the tape. And then the bags, you actually, do you see how one side is paper?
This side looks more like white paper.
And then the other side is like a clear plastic.
like a clear,
but the
yeah.
paper side has to be up. It's the way the autoclave, the steam circulates so that it gets into the bag correctly, and actually, as long as the autoclave is working, then it is also sterilized.
And you know the indicators on the bags are a little different. There's one that actually says steam, and then there's one that says EO. So for our purposes, we have steam autoclaves. We look at this pink and make sure that it actually turns brown. She may have one over there that,
Brown, this one's done.
and then this
You
is
see
the
it?
pink beforehand.
We'll show her both of them.
The before and after sterilization.
Okay. Okay.
So we'll switch places.
So-
I'm gonna come down to the autoclave. There's a few things that I want you ladies to recognize when we load an autoclave. The big thing is the door is like a chamber. So you just pull this open and back if it's locked, and you'll see this chamber here that you can pull out drawers, push them back in. A major thing that you wanna check and maintain is the water level, because this is a steam autoclave. So if we run out of water, guess what happens? It overheats and fries basically everything that's in there. So you wanna make sure there's a lot of water. So this is our green safe level right here, and then the red, Brittany, you can peek over if you want to. So we're right about here, so we're in the safe level, and I think I showed you ladies this before, but I just wanna kind of confirm that you keep watch on this. And can I put regular water from the tap in here? No, good, distilled, and that is right below us here. So if you would ever come across, you're gonna have distilled water in your office, that is what you add to your autoclave. What's that?
Their choice water.
Yes. And then you're gonna put this in, like Miss Usesh said, with the tape facing up. So when we open the autoclave, we see that the tape's facing up and it's been autoclaved, that the process has happened. And then the paper side is up when we place these items. And when you're loading an autoclave, the best thing to do is not to overload it and stack things on top of each other. It's best to have a nice flat layer of things so that fit everything perfectly on one shelf.
It's just like your dishwasher at home. You can make everything fit, but if it's overloaded, when you go to take it out,
It hasn't been hit, and it's the same thing on the autoclave.
So you just slide that back in the tray, and then you're going to close the autoclave. So to close it, you can't just go like this. It just basically hits like a wall. You're gonna lift this, hold back, and then close it like that. Okay? So it has a nice lock. We're obviously not going to start it, but if we were, we would be selecting pouches and hitting start. Okay?
Great job. Anybody have questions? All right, so, we're good. Thank you very much for our videographer.